As a child in school, I had begun to enjoy learning through the sciences, and I had great mentors and teachers up and through elementary school all the way through high school and college. And I felt like that was a good blend for me with my personality and my academic interests. Becoming a doctor was something that allowed me to blend both what I like and what fascinates me and be able to bring my gifts to helping patients as well. When a patient comes in to see me for a problem, it may not be that her problem is the one that she's thinking about at that moment. I think that it's important to recognize that there's an entire human being in front of us and not just a breast or a cervix or a uterus, and she's a whole person. And I think it's important, and in my approach I try to address many of her things. Is she sleeping well? Is she exercising? Is she dealing with financial problems with her children? And that's part of what I really enjoy from year to year, is seeing how patients develop and grow and how their lives are changing. I love following up with patients from year to year, and as we grow old together, I think it's been one of the best parts that I have in my practice. A patient who comes to me will get my undivided attention, and they will be my primary focus for the entire time that we're seeing them. And I think it's important to kind of not only address the things that are being said outwardly or the chief complaint that's listed on their chart, but oftentimes there's many minor things that are just simple questions that get answered in that time with a certain body language or a certain facial expression that I can tell that there's something more, and I look to find those things. And I think it's important that a physician addresses everything and not just the bullet points of what our computers tell us we have to answer. When I'm not seeing patients, I am very busy with my 5 children, and I just recently became a single mom, and so I manage a very busy house with lots of pets and kids and soccer and tennis and lots of laundry. So that is, when free time, I don't know that I actually have it, and I actually like to tell patients that if they're not sure if they want to have children, they should come to my house for 15 minutes at either 7 a.m. or 7 p.m. and they will know pretty soon if they want to have kids or not, because that is what my life is all about, and I do every minute of every day is spent trying to make their lives better as well.